Hello everybody, welcome to my channel. This is a pathology video on hepatobiliary pathology. This is on cirrhosis. This is the fifth in the series of videos on cirrhosis. The topic is complications including portal hypertension, etc. This is by Dr. CSBR Prasad, Professor of Pathology, Sri Devaraja's Medical College.
And coming to the portal hypertension, so the portal hypertension by definition is increased resistance to portal blood flow. So there are many causes for portal hypertension. There are prehepatic causes like portal vein thrombosis or something causing obstruction, either in the form of tumor sitting on the portal vein, or it may be due to obstruction at the porta hepatis level. We say, for example, tuberculosis affecting the um, lymph node in the porta hepatis can cause obstruction, or sometimes this hydrated disease can occur in the intra-abdominal area, or it can occur in the liver, which may cause pressure symptoms over the portal vein and causing portal hypertension. If you look at hepatic causes, main thing is cirrhosis of the liver, and in addition to that, schistosomiasis, tuberculosis, sarcoidosis also can cause obstruction and thereby increasing the tension in the portal area. And post-hepatic causes, this right heart failure, which causes the increased hydrostatic pressure, and constrictive pericarditis, and hepatic outflow obstruction, which we will call as, if it is thrombus, which is equated with what you call that Budd-Chiari syndrome. Okay. So these are the causes for increased tension within the portal vein. And portal hypertension clinical consequences is the patient develops ascites, and the portosystemic venous shunts may develop, and the patient also suffers from enlarged spleen due to congestion, and hepatic encephalopathy is a late event. So I have shown you these images, the consequences of cirrhosis that can be appreciated here. And but see, because of increased portal tension, secondary to cirrhosis, there is enlargement of the spleen because of portal hypertension, and this enlarged spleen and increased tension within the portal area tries to find out the other alternate pathways for exit of blood that is getting stagnated here, mainly in the form of portosystemic anastomosis, which can be appreciated around the umbilicus, lower end of esophagus, and also in the anorectal region. So the main manifestation of this portal hypertension is ascites. So ascites is collection of fluid in the peritoneal cavity, and if it is more than 500, clinically you can appreciate or detect it. But most of the cases will have lots of fluid in the abdomen. Their bellies will be bloated because of accumulation of fluid, and it is usually a serous fluid, and protein is less than 3 grams per dl. And if you look at the mechanisms of ascites in cirrhosis, it is due to sinusoidal hypertension because of fibrosis occurring in the sinusoidal area, and percolation of hepatic lymph is getting obstructed, and because of this obstruction of the lymph, because of fibrosis in the what you call space of Dissay, there is a certain amount of obstruction to the lymph flow, and this lymph seeps into the peritoneal cavity. And if you are a surgeon, or if you attend surgeries on cirrhotic patients, and when you open the abdomen of these patients, you may see actually fluid dripping from the surface of the liver because of this lymph percolation from the hepatic surfaces. So which we'll call this as weeping liver. So drops of fluid may drip from the surface of the liver, and it appears as if liver is weeping. And intestinal fluid leakage. So whenever there is portal hypertension, the portal vein is formed by splenic vein and mesenteric vein joining together forms a portal vein. So when there is increased tension in the portal vein, it is reflected onto the mesenteric veins also. So the decreased drainage is associated with edema and seepage of fluid from the surface of the intestines, which accumulates in the peritoneal cavity, producing ascites. And in addition to that, these patients may have what is known as decreased renal blood flow and with the retention of sodium and water, which aggravates the mechanism or accumulation of fluid in the body, including ascites. So, portosystemic anastomosis or shunts can be appreciated in the form of hemorrhoids, esophageal varices, or caput medusae, depending upon the site. And this is the esophagus, wherein you can see that blackish streaks of engorged veins, so esophageal varices. And this is a fixed specimen showing dissected esophagus, and one vessel is showing a thrombus. It is very much dilated. And if you look at the other areas, there is engorgement of the veins with ulceration of the overlying epithelium, especially on the top portions of the image. And endoscopically, you may see worm-like swellings in the lower part of the lower one-third of the esophagus, and this is the varicosities of the esophagus. And in the anorectal region, you may see these dilated veins in the form of hemorrhoids. Microscopically, hemorrhoids show the ulceration and probably the engorged veins, which may show thrombus if there is stasis. And ascites is another manifesting feature of portal hypertension, and this may progress on to what is known as umbilical hernia, again due to increased tension within the abdominal cavity. And caput medusae can be appreciated around the umbilicus. Again, this is one of the examples for portal hypertension, wherein there is development of shunt. And because of cirrhosis, if the portal hypertension is due to cirrhosis, the patient may have what is known as increased estrogen levels, which manifests in the form of appearance of engorged capillary channels with a central dilated main capillary. Okay. So this is called as spider angiomas, which are more commonly seen in the upper half of the body. And again, you can see that very well characterized spider angiomas, many seen on the shoulder. You see the bigger one, center is intensely red due to dilated bigger vessel with radiating smaller capillaries from this bigger one. So like limbs of the spider. Okay, so spider angiomas tells you that it is a hyperestrogenic state. And hyperestrogenic states also may have warm hands, may induce warm hands, and these fellows will have reddish coloration of the palms. And splenomegaly is another feature of portal hypertension. Enormous size of spleen can be appreciated in these persons. Probably it may extend to the right iliac fossa, or it may weigh more than 1 kg. More than 1 kg. We'll call this as massive splenomegaly. So there are very few causes for massive splenomegaly. Among them, cirrhosis is the topmost, and other one, hematological conditions like the chronic myeloid leukemia, hairy cell leukemia are known to have very big spleens. In addition to that, anything that causes portal hypertension, it need not be cirrhosis always. Anything that is causing portal hypertension may result in huge spleen. Don't forget one more hematological condition, that is myelofibrosis, also can have very, very huge spleen. So occupying entire abdominal cavity, extending up to the right iliac fossa. Thank you.
Thanks for watching. Please subscribe by clicking the button subscribe.